Come in.
Hi, my name is Erica. I'm going to be your nurse today. I'm going to start off and provide you some privacy and get my hands washed here. Can I have you start by confirming your name and date of birth?
Jennifer Schwen, 11/28/69.
All right, today we're going to do a neurological exam. We're going to test how your brain and your body are working together. I might have you do some things like stand up and walk around the room for me, or smell some things, or get familiar with objects I put in your hands while your eyes are closed. Is that okay?
Yes.
All right, we're going to start off with some brief history. Do you have a history of migraines?
No.
Do you have any history of stroke?
No.
Good. All right. Since I've already had a conversation with you, I know you're orientated to person because you confirmed your name and date of birth for me. Can you tell me where you are?
I'm here for a neurological exam.
All right, and that would take place,
In the doctor's office?
correct? And what year is it?
2020.
Can you tell me who our current president is?
Donald Trump.
Can you tell me who the first president is?
George Washington.
Correct. Awesome. So the patient is alert and orientated. She seems comfortable from what our conversation is so far. Your speech is clear. Your mood and affect is appropriate. I would say your A&O times 4. Now we're going to start with the cranial nerves for your nervous system. I'm going to do cranial nerve 1 first, which is the smell test. So I'm going to have you cover one eye for me, or cover both your eyes for me, and plug one nostril for me. And I'll just have you take a sniff, and can you tell me what that is?
Rubbing alcohol.
Correct. And then I'll have you plug the opposite nostril, and tell me what that is.
Rubbing alcohol.
Correct. Good. So smell is intact. And then for your optic, we would have you stand 20 feet back and read a Snellen chart to the lowest line possible. You've already told me that your vision is 20/20, so that's good. And then next we're gonna check your cranial nerves 3, 4, and 6, which is your vision. So if I'm gonna check your eyes. All right. Good. And your eyes so far coordinated with Perla, which means your pupils are equal, round, and reactive to light accommodation. And then next we're going to do the positions of gaze, and I just want you to follow my pen with just your eyes. Very good. So vision is correct. And next we're going to do cranial nerve number 5. Can I just have you pretend like you're chewing for me? Good. I'm just going to feel right here. Good. And then I just want you to close your eyes and tell me when you feel the cotton ball touch your face.
I feel it. Yep. Yes. 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 Yes.
Good. That's all intact there. Next, we're going to move on to cranial nerve number 7. Can I have you smile for me? Squint your eyes, frown, and show your teeth for me. Good. So facial nerve is intact, and I'm going to do cranial nerve number 8 next, which is the whisper test. So I'm just going to have you cover one ear. I'm going to whisper a word into your ear, and I'll have you repeat it out loud for me, okay?
Okay. Dog.
Correct. We're going to do it on the other side. I'll have you cover one ear.
Cat.
Correct. All right, hearing is intact. Next, we're going to move on to the mouth. We're going to do cranial nerves number 9 and 10 and 12. So number 9 would be the gag reflex. We would put the wooden thing in your, on your tongue, and then you would gag. But we won't make you go through that.
Thank you.
Number 10, we're going to have you open your mouth and say, ah, for me. I'm going to shine a light. Make sure the soft palate and the uvula go up at the same time. Good. And then number 12, can you stick out your tongue for me? Make sure it's midline, which it is, which is good. And then we're going to backtrack to cranial nerve number 11, and I'll just have you shrug your shoulders for me. Good. Good. All right. Cranial nerves all seem intact. Now we're going to move on to observe your gait. If I could just have you stand up for me.
Mm-hmm.
Perfect. And then I want you to walk just normal, how you would every day. Okay, I'll have you stop, turn around, and do heel to toe for me. That's fine. Heel to toe, good. All right, now I'll have you put your feet together. We're gonna do the Romberg test, and I'll just have you close your eyes for me. Perfect. All right, you can go ahead and sit back down for me. Your gait seems great. Next, we're gonna do coordination and skilled movement. I'm gonna have you put your hands on top of your lap and then go from palm side down, palm side up, back and forth for me. Perfect. Now what I'm gonna have you do is put your finger on my finger. All right.
Oh, I go with you?
Follow my finger. Good. All right, now we're gonna do your finger to nose. So you're gonna touch your nose and then touch my finger. Perfect. Touch your nose and then touch my finger. Awesome. And the next one I'm gonna have you do is I'm gonna have you bring one of your heels up and slide it down your shin. All right, and I'll have you do it on the other side. Just once, slide down. Perfect. Next, we're gonna test your sensory system. So we're gonna start by doing the superficial. That's where you tell me whether you're feeling sharp or dull pain.
Mhm.
Just for reference, this is gonna be the sharp side and that's gonna be the dull side. So we're gonna do your upper body here.
Soft, 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 soft,
All right.
sharp, 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 sharp,
They're all intact on the top. We're gonna do down your leg now.
soft, 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 soft,
All right.
sharp, 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 sharp.
Perfect. Now we're gonna do light touch. So you'll just tell me if you feel this light touch.
Light touch, light touch.
Just tell me when you feel it.
Oh, yes, 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 yes.
All right, perfect. So then I would normally have a tuning fork and I would hit it so it caused a vibration on your bony prominence, either on your wrist or on your ankle, but I do not have one of those. And then we're gonna do now hot versus cold.
Okay.
So when I put this item on you, you just tell me if it's hot or cold, okay?
Mhm. Hot,
Good,
hot,
good. And
cold, cold.
good. All right, and now we're gonna do the stereognosis, which is when your eyes are closed, but you're able to identify the object that I put into your hand, okay?
Okay.
All right, close your eyes for me.
Okay.
Open your hands.
A coin,
Correct. We're gonna do it with the other side now.
a coin.
Good. And then we're gonna do kinesthesia, which is where I move your fingers and you tell me whether I'm moving them up or down, okay?
Okay.
All right, ready?
Up,
Good.
down, down, up, up, down, up.
Very good. All right, now we're gonna do graphophasia, which is where I draw a pattern on your palm, and you're gonna be able to tell me what I'm drawing. So go ahead and close your eyes for me and hold
Okay.
out your palm.
J,
Correct. Now we're gonna do the other hand.
S.
Very good. All right, and then we're gonna go to your deep tendon reflexes, which normally we would have a reflex hammer to do. We're gonna start with your biceps here. So we'd make sure we're on the tendon and hit the hammer and you would reflex. Very good. So 2+ expected and 2+ expected. We're gonna do the biceps on this side. Good. Triceps. Very good. And then we're gonna do the brachioradialis. Do here. Good. Do it on the other side. Very good. We're gonna do your patellar now. Just your kneecap. Ready? Good. And the other one. Good. We're gonna do your Achilles tendon. Very good. Very good. And then we're gonna do the superficial Babinski's test where you draw the backwards J here up to the toe. So I'll just have you put your foot up. And good. We're looking for your toes should curl. And if you have dorsiflexion of your great toe, that means you have a neurological issue we should be concerned about. So overall, there were no abnormalities that I found today, and I would discuss any appropriate findings with my patient using appropriate language, and then I would document. Thank you for your visit today.